Hello, my name's Brian Procter, and I've been a board certified family physician in McKinney, Texas, for about 20 years. It is my understanding that some people, or a lot of people, are trying to get to the truth about COVID-19. I respectfully suggest that there's a much bigger story here. Most commentators are discussing inpatient treatment only. I think that the big story here isn't inpatient treatment at all, it's outpatient treatment. How do we keep people out of the hospital? That's the big question. If patients are admitted to the ICU, then their chances of survival were dismal. They are improving though. But what happens if we treat patients 3 to 6 weeks earlier when they first develop symptoms? I've been treating COVID-19 patients in the outpatient trenches for over 3 months now. I am using hydroxychloroquine, zithromax, losartan, aspirin, CBD oil, and zinc. All of the prescriptions cost less than $50 cash at my local pharmacy. This saves insurance companies millions of dollars. We have identified, diagnosed, and successfully treated these patients at a relatively early point in the course of the disease. It is these statistics that are amazing. I have treated over 75 patients now without a single ER visit, hospitalization, ventilator, or death, and all without any cardiovascular side effects. Cardiovascular side effects from hydroxychloroquine, it's totally misleading the public. The potential for side effects are minute. I know one colleague in Dallas who has treated 5 times that many with the same success using the same regimen. I even treated one patient without insurance who was discharged from a hospital the day before after being treated with IV fluids for only 4 days, along with Phenergan or promethazine for nausea. She was released from the hospital still feeling terrible. She came to see me the next day. I put her on the regimen. She felt much better 2 days later. Today, she's doing great, along with the rest of her family. We are 2 community doctors in the Dallas area that are using early aggressive outpatient treatment to handle the disease with a 100% success rate. 100% success rate, the benchmark for that meaning 0 admissions and no cardiovascular side effects using medications that have been around for decades. Therefore, I believe if we can treat patients early for $50, we seem to be successful at preventing hospitalizations, ICUs, and death, not to mention saving tens of thousands of healthcare dollars per sick patient. My local ICU doctors have pleaded with me to keep doing what I'm doing. The answer seems to be early aggressive outpatient treatment and not contact tracing, which contact tracing is really a means towards socialism and tracking humans and their every movements. Plus, you can't even get the public health department on the phone. I think quarantine is destroying millions of people's lives. The suicide rate has gone up exponentially. Wearing masks is just ridiculous as a long-term solution. There isn't any proven data, and it prevents the transmission of passive immunity, which is a bad thing. Also, the vaccine that so many have talked about, it'd be great if we had it now, but the problem is we don't, and we probably won't have it until next year. But if everybody used this regimen, I don't think we need the vaccine. SARS and MERS died out, so this likely will too, and they were coronaviruses as well. Also, testing, the problem with testing is it has a really high false negative rate, up to around 20 to 30%. Like I said, I treated 75 people, but only 28 of those had positive tests. The rest of them had negative tests, but they had every symptom, so I treated them anyway, and they all got better. Also, social distancing is not going to sustain our gross domestic product with 25% or even 75% occupancy at movie theaters, restaurants, resorts, hotels, and things like that. So watchful waiting, a tactic that's been used by emergency departments all over the country, where you go in there, they diagnose you with COVID and tell you to go home and wait it out. This has needlessly resulted in 100,000 deaths. So we could have saved all of these people if we'd done something about it at the point of diagnosis. So We could also place all nursing home patients on hydroxychloroquine prophylaxis for 180 days on a voluntary basis, of course. This could theoretically prevent thousands of needless hospitalizations and deaths. As many of you know, patients with rheumatoid arthritis that take hydroxychloroquine daily and have been taking it daily for decades haven't had any side effects at all. The incidence of COVID-19 in these patients is really, really small. I've only heard of one case in the United States of a patient with rheumatoid arthritis taking hydroxychloroquine every day who's contracted COVID-19, and they did just fine. Their symptoms were minimal. In conclusion, if we treat COVID-19 just like anything else, like we treat the flu, pneumonia, sinus infections, hypertension, and diabetes, early and aggressively with this regimen that costs less than $50 out of pocket with 100% success, which is a far better stat than treating all of those other medical diseases, then why is the country partially shut down? Why are we wearing face masks? Why are we doing social distancing? This political sham must stop. The American people deserve to know that they can go to their regular doctor and get treated early with a regimen that is completely safe and extremely effective. And they do not need to worry about ending up in the hospital and dying. The public is unaware of this. Please educate them with the truth. The country needs to return to normal now. 23 years ago, I took the Hippocratic Oath. It is posted in my lobby. It is my creed and my promise to my patients. The FDA, CDC, NIH, WHO, and Dr. Fauci are not mentioned in this oath anywhere. I didn't pledge allegiance to them. I pledge allegiance to the Hippocratic Oath in the United States of America. This is the real story. This crisis is a total sham in the way it has been handled by most states. And COVID-19 is a disease that is safely treatable if the treatment is initiated early without significant side effects. My heart goes out to the hundreds of millions of people who have been needlessly affected and who have suffered in the wake of this pandemic. If all PCPs, primary care physicians, start this regimen soon, the pandemic will end in a couple of weeks and never return. Y'all have a great day. God bless America.